event, we have Aparna Somanathan, who's a practice manager for health, nutrition, and population for East Asia and the Pacific at the World Bank. She's worked on health system strengthening issues for over 15 years in a range of countries, including Bangladesh, China, Estonia, Georgia, Indonesia, Kazakhstan, Sri Lanka, and Vietnam. She's also extensively worked on the implications of population aging on health financing and service delivery. Over to you, Aparna, to sort of get us started.
I might try this mic. Does it sound all right? Can you all hear me?
Could be better, but just I think we just
Perhaps
start.
I'll
Can't hear you, Aparna.
Is that better? Yeah. Sounds like it, right? So to begin with, I'd really like to thank all of you at the Center for Policy Research for this invitation, for organizing this panel. I mean, for myself and other World Bank colleagues, it's really a pleasure to be here and to sort of share the products of our collaboration over the years. So globally, coming out of COVID-19, there is a lot of interest in how much governments spend on health, including on whether countries will remain at pre-pandemic or will return to pre-pandemic spending trends, or if the COVID crisis will serve as a wake-up call to invest more in health, or if the multiple fiscal and financial crises that we're seeing around the world will actually set countries back in terms of social sector spending. But more important than the how much question is a question of what are countries spending on? What is being spent on primary healthcare versus hospital, on nutrition versus flagship programs, pandemic preparedness, and for whom? Are health budgets reaching the poor and vulnerable, or is spending largely captured by the better off? And diving into health budgets, analyzing, understanding health budgets is quite critical to try and answer all of these questions. But in most countries, as we know, budgets are not the most user-friendly documents. And in India, as you all very well know, this challenge is multiplied because of the union government budget versus state budgets. There are almost 30 health budgets. And on top of this, there are centrally sponsored schemes, finance commission grants, and other mechanisms to transfer resources between centers and states. So making sense of all of these budget documents is no easy task. So the key challenge at hand, and the focus of today's panel, is how to translate budgets into policy relevant analysis. So just to highlight that the intersection between public financial management issues and health service delivery is a growing focus area for the World Bank and a frequent topic of conversation in our health operations at both the state level and union levels. And analytical work like this on public and today we're represented by our governance colleagues as well as health colleagues. So the focus of this event on how budgets are reported and monitored is, of course, a key pillar of public financial management systems. We're therefore very pleased to have collaborated with CPR in the production of this health budget primer, and we're already putting it to good use in our practical work at state and central levels. So I look forward to the panel discussion. Thank you again for inviting us, and back to you.
Thank you so much. Before we start, just wanted to, as you rightly said, we should mention all the authors. This is a collaborative effort between the World Bank and us, CPR. And I think three of us, two of you in the World Bank, put our heads down together to try and almost break our heads to say, let's now try and demystify things that have been troubling us for a while. Rajesh and I have spent a lot of time trying to share stories and to say, how do you actually answer this question? And often it requires a lot of detective work. And so this is a joint effort by Ritwik, my colleague Ritwik, our former colleague Sharad, me, Raj, and Owen. So thank you everyone for joining us for us to share some of our trials and tribulations on trying to unpack and demystify health budgets. In terms of the flow, I'll make a short presentation, and then after that, maybe Ritwik can introduce Owen and the panel speakers. Mm. Sorry, 1 second. Not working. Ah. So, like I said, I think for many years my name is Avni. I did not introduce myself. And I'm a senior fellow at the Center for Policy Research, where I lead an initiative called the Accountability Initiative. For the past 15 years, we have been trying to study budgets and scheme finances. Every year, budget time, share our learnings on how schemes have been performing with members of parliament, with researchers, with development practitioners, journalists. When we first started, we viewed budgets in some ways as an accounting tool. But I think my journey and introduction to the Accountability Initiative taught me that it's a lot more than that, or it can be a lot more than that. To some degree, it's a policy and fiscal tool to indicate intent and address macroeconomic concerns and challenges. It's also a planning tool, of course, in terms of trying to understand what are the priorities of the government. It's an accountability tool, of course. So the extent to which the government has been able to allocate resources and the extent to which it has been able to fulfill its promises. And of course, it's a transparency tool as well. It's part of our right to know where our money goes, since we all pay taxes. But despite all these reasons why budgets are important, India's health budgets tend to be, not just health budgets, India's budgets tend to be complex, varied, and often poorly understood. So the objective of this primer was to offer the readers a way to understand and interpret India's union and state health budgets, well as some of the, as you said, there are so many different budgets, so or districts as well. It is, of course, to understand the different actors involved, processes involved, and it delves into a little bit into the budget documents themselves. And one of the things that we were brainstorming a lot on is what can budgets tell us and what they also can't. So it's important to try and address both. In terms of the audience, it is for researchers, it is for citizens and development professionals. It is, of course, for journalists and media as well. And we hope that it is also for government. It has been an important learning for us that often government at different levels do not actually fully understand a different department or don't always understand where money gets stuck. So it is for government as well. Quickly on what the primer covers, we have an entire chapter on budget building blocks, and this includes in some ways the processes, right from budget formulation and implementation, preparation, and enactment, evaluation. It tells us about this cycle as well as detailed timeline of the budget making process. It also tells us about the actors. One would think that the number of actors that are involved at different levels is quite fascinating to try and understand.
Of course, it tells us about the budget documents, what to look at, provides some tips to on information into the budget heads, and that's where we get technical on the on center-state relations and resource flows, whether it is what are the different sources of funding between the union and states. For states, more than half of the money is from states' own revenues in quite a few of the states. For the union government, funds come through centrally sponsored schemes. Of course, I'm sure most people have heard of the National Health Mission or the ABPMJY, which is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, or even central sector schemes. And as you can see, about last year, 55% was of the union government's Ministry of Health and Family Welfare spending was from centrally sponsored schemes, and 19% was for central sector schemes. It also tells us a little bit about the complexities of flow of funds. Talked about we did passing through 25 desks just at the state level. And so it tells us a little bit about the flow of funds. And then, of course, chapter 4 is the more interesting one. It's actually, in some ways, a how-to guide. We've tried to present it in question-answer form to try and present both the challenges that we have all encountered and a few tips where possible on how to get around them. So one of the basic questions when I first started was, what are the budget documents that I need to look at? All different types of documents that when I
Avani, your voice is breaking so much that we can't understand what you're saying. Anyway, keep trying, yeah.
I'm trying the fourth mic now. Hopefully this will work. I think one of the first things that I learned starting off as a public finance person was that never use data from different sources. And we have a table there to explain why. The same indicator will have very, very different numbers from different data sources. And I remember once we'd filed RTIs, and I think 2 of us filed RTIs, and for the same date, we had different responses and different numbers coming back at us, to the point that we had to call up the RTI officer and ask him which one was the correct number. So be aware when you're using data from different sources. We've also tried to explain how do you actually calculate total health budget and expenditure. And the typical mistake that all of us make is health means health department. But as you'll see on the table on the left, large number of departments. In some states, you can go to as much as 4, 5, 6 departments that will have funding for health. So funds are dispersed across departments. And there are, of course, also procurement agencies that may need to be looked at as well. So whether it's procurement for capital projects, for drugs and consumables. So actually trying to even just get the total health budget and expenditure requires you to go through a large number of departments and receipts and expenditures of some of these agencies. For scheme information, again, it's often not as straightforward. Budget codes in India aren't standardized, especially after the 3rd level out of 6. So we've seen in Karnataka, for instance, it's booked differently. It's booked after a point at the minor head level, which is the 3rd level, as other expenditure, and booked under public medical and public health. Whereas in Andhra Pradesh and Telangana, it's booked under family welfare and a completely different budget head. In fact, it's spread across multiple budget heads. So often one needs to go down to the fourth, fifth, sometimes even the sixth level to actually understand and identify scheme allocations and expenditures. We've always wanted to, in health, try and classify health budgets differently, whether it's an economic classification, whether it is a classification by levels of health facilities, so primary health center versus community health center, well, or whether it's by levels of care, primary, secondary, tertiary. But unfortunately, it's again not as easy to do so in our budget documents. Often one needs to go right down and drill deeper and deeper. There are people like the NHSRC that have tried to make this simpler by creating a toolkit. But here too, we've struggled a little bit in trying to use it completely, primarily because of the fact that there is, of course, some element of subjectivity and assumptions that we all need to make, but also that since it was created using one state budget and every state budget is different, you often need to still dig a little deeper and drill down further. One of the things that in fact, we've done a different World Bank project as well, trying to understand whether we can look at it from a geography lens. So districts, health expenditure. Of course, district budgets don't exist in most states. And so it's not always possible to look at or disaggregate health expenditure by geography or even by districts. You need to sometimes do some estimations through treasuries and drawing in disbursing officers. A lot of the expenditure tends to be booked centrally. So last time we had found that the capital state had a big spike and it looked like it was the primary spender on health, but actually it was just that it was things that were booked centrally. We've also given a lot of information on documents that you can look at specifically for the National Health Mission. The record of proceedings document is probably the single and most useful document. And through the primer, you will see a large number of statements mentioned, which can be delved into to look at a little bit more disaggregated information. What we've tried to show different types of analysis that can be done. I think interstate is something that all of us often try, as well as time series data. You'll see a lot of budget analysis starting post 2014. And there is no other reason for that except the fact that budget documents, fund flow structures changed significantly in 2014, which means that analyzing information prior to 2014 requires a lot of jugglery, which isn't always possible to do. And of course, like I said, since data structures and budget documents aren't standard, sometimes not even sometimes they're only in Hindi, which is not always accessible for every single person. It makes actually looking at interstate difficult. Lastly, I think we've been trying to do some information of trying to see how much we can disaggregate budgets by different socioeconomic groups, by different population groups. And here too, it's been a challenging task. We've been doing we did a project on trying to look at tribal health expenditure, and even the Ministry of Tribal Affairs did not fully know where their money goes once it goes into the pool of health expenditure. So tracing funds for each group isn't very easy. And it again requires delving very, very deep into specific line items. So we'd love your comments and feedback. The idea, like I said, is to make budgets more accessible for everyone. And so the report is online, and please do take a look. I'll pass over to Owen next, actually Ritvik, and to introduce Owen.
Yeah. So we do hope you'll take a look at the report. It's fairly comprehensive. In fact, it was much longer and had to be reduced a little bit because readers could easily get lost. You might still get lost, but hopefully you'll find what you were looking for. So just to introduce one of the co-authors of the report, Owen, who's a lead economist with the World Bank. He joined the bank in 2005, and since then he's been working on health financing and health policy in, well, pretty much across the world, in Europe, Central Asia, and South Asia. He was in Delhi from 2016 to 2022, but is now elsewhere and will join us online. Over to you, Owen, for your remarks.
Thanks, Ritvik and Avni. Can you hear me okay? Great. So good afternoon, everyone. I think we want to move to the panel quite quickly. So let me just take maybe 2 minutes to provide a little bit more of the backstory of how we came to producing this primer. And I think it sort of gives a concrete example of one of the some of the challenges in budget data analysis. So I think it was around 2018, and Avni was alluding to this, where we started to look at whether public health spending in Odisha was targeted to the poor. So whether it was reaching, the state health budget was reaching poor and vulnerable households. And not just Odisha, we wanted to look in a couple of other states as well. So the approach we adopted to do so was to try to break that state health budget down into how much was spent across the 30 or so districts and how much was being spent across sort of broad facility categories, so PHCs, CHCs, district hospitals, and so forth. So one might think sort of ex ante that breaking a state health budget into district level spending and broad facility categories wouldn't be too tall of an order, but in fact it was not at all easy. So to cut a long story short, we managed to get treasury data from the state finance department at the DDO level, so at the drawing and disbursement officer level. The catch was that there were like 22,000 entries, and these had to be manually classified into facility types and then also the district aspect. And then on top of that, if you want to add in, as we did, the National Health Mission budget, and allocate that at the district level, we had to go into the PFMS, the Public Financial Management System, which is not linked to the Treasury data. So that was a whole sort of task unto itself. So eventually we got there. We got some estimates for district and facility-wise spending for the state. And then we combined this with household survey data. But it was a tall order. We originally wanted to do it in more than just one state, but Odisha was enough work on its own, and we basically were unable to make any progress in Rajasthan and Maharashtra because of the way the budgets are organized and the access to the data. So I think the key point is that we had to improvise the methodology as we went along. We sort of had to sort of search through the dark a little bit to see how best to go about this task of answering a relatively, what we thought should be a straightforward policy relevant question. So coming out of that exercise, we thought there would be value in having a primer which could sort of serve as a public good for others who wanted to do similar analysis. And I think ideally perhaps nudge forward a conversation around making budget data for health and other sectors more user-friendly. So let me leave it there and pass it back to Ritvik and Avni. Thank you.
Thanks a lot, Owen, for your remarks. It is my honor to introduce all our speakers today as we move to the next section of this event. So first we have Ms. K. Sujata Rao. Sujata ma'am was a 1974 batch IS officer and a former Union Secretary at the Ministry of Health and Family Welfare, Government of India. She's been a civil servant for over 36 years, and in her own words, quite uniquely spent 20 years in the health sector in different capacities at both state and union level. She has occupied posts from director all the way up to Union Secretary in the Ministry of Health and Family Welfare, and was also Secretary Health in the state of Andhra Pradesh. She's the author of a book which is highly recommended called Do We Care? India's Health System, which was published by Oxford University Press in 2017. Next, we have Professor Indrani Gupta. Professor Indrani Gupta is Professor and Head Health Policy Research Research Unit at the Institute of Economic Growth in Delhi University. This unit, the Health Policy Research Unit, was set up by her in 1998, which is the first of its kind in India and remains among the few places in the country that conducts policy-oriented research on the health sector using economic analysis. Her work experience includes teaching in positions at academic institutes, the World Bank, and the Government of India. And her areas of interest cover a wide range of topics in health economics and policy, including the demand for health and healthcare, health insurance and financing, poverty and health, costing and cost effectiveness, and the economics of diseases and international agreements. So a very wide range of topics. Sorry, I made a mistake. IEG is not a part of DU, even though it is located bang in the middle of Delhi University and where we used to get our printouts from. So my apologies. Next, we have Rukmini S., who all of you would know is the author of the best-selling book, Whole Numbers and Half-Truths, What Data Can Tell Us and Cannot Tell Us About Modern India, which was published in 2021. She is an independent data journalist based in Chennai, and her work focuses on inequality, gender, caste, and politics. She was previously the national data editor of The Hindu and now writes independently for a number of Indian and international publications. She also hosted a podcast in the pandemic called The Moving Curve, which won an Emergent Ventures COVID-19 India Prize in 2020. And her work on the toll that COVID-19 took in India won the Sigma Award in 2022. Over to Avni to now lead the next bit.
No. Yes. Thank you all so much for joining us. We thought that before we get to specific questions, and I do have specific questions for all of you, maybe if you could start with Ms. Rao. Just would love your thoughts on, I know that you shared very sweetly on email some of your preliminary thoughts on the need for the primer and the content of it itself, but would love to hear your opening remarks before we get into more difficult questions.
Thank you, Avani, for inviting me. First of all, a happy new year to all of you. And also I want to convey how happy and thrilled I am to have read the primer. It's superb. It's an excellent effort that you've made, much needed, and I wish it was done 20 years earlier. But anyway, never too late. But it's really going to be very, very, very useful, because as you've realized that even we find it difficult to make our way through the budget. I mean, it's a heroic feat if you can understand any budget. And Bihar's budget, of course, takes you to the ultimate. So, it's my hearty congratulations to you. And I'm so glad to be meeting Indrani and Rukmini also here. Rukmini, I want to tell you that somebody gifted your book to me. At that time, I was writing a book, I was planning, because it changed now, Public Policy Response to the COVID Pandemic. And so they said that now here's this book, you write the whole truth with half numbers. So I thought that was quite funny. And that's exactly how the situation is. Okay, now coming to the topic, Avani, I think this, not only is it a superb document, but I would only like to suggest, if you may consider at the end of the, if you could have an appendix where you take any one item and help the reader to actually practically do that whole exercise. Say a year 22, 23, how much did central and state governments spend, say, on RCH or on TB, for example, or anything? And then the complexity of it all will come out, because then you would have been looking at different, how do you get those expenditures? Army spending on TB, so is ESIS, ICID spending on TB, and then there is this, our own CGHS is spending probably on TB, the Ministry of Health is spending, the states are spending, and so on, and NGOs are spending. So not necessarily a national health account, but through the budget processes, how much has actually been spent would be a very interesting exercise, I think, for them to understand where all it is located within the budget itself. So that's what occurred to me, that it would be really nice. For example, family welfare is not only on the family welfare. Much of its budget is also spent in the postpartum centers or something of the medical college in AIIMS or in a secondary institution. So then that also comes under family planning. And so you have to really eke out figures from all over. Maternal health, Tamil Nadu has its own state budget for giving cash benefits to pregnant women. The central government has JSY, and in the central government, again, the Women and Child Development Department also has. So, how is it getting duplicated, or is it all being bundled together? It would be a very interesting exercise if you could do one. But my opening comments are excellent, superb, and really congratulations to you all.
Thank you so much. Maybe we'll just start with opening comments from everyone. And then, of course, I have, like I said, slightly more difficult questions for everyone.
Thank you, Avani. And hello, everybody. Hi, Sujata, Rukmini, and Owen. I totally want to endorse what Sujata said. This is really very timely, in fact, much delayed. I mean, I wish we had it when we started our project. We have been working on the budgets for the last, I don't know how many years, via the Gates Foundation project, where we were looking at the implications of the 14th Finance Commission restructuring on health budgets. And we're still doing that, believe it or not. We have a team, and they should have been here, actually, who have been entering the budget data for years, trying to make sense of the data for 5 states, UP, Bihar, and 3 other states. So we are users. I mean, as researchers, we are users of the budget data. But this has been a very painful exercise. I mean, it's really, I called them before I came here, and I said, okay, your last comments on what were you dealing with when you were looking at these, but the demand for grants data and entering those into Excel sheets. They had to actually start from scratch. And it's really not easy. It isn't. My main comment is that it shouldn't be left to researchers to make sense of this kind of data. It should have been, there should have been a kind of a handbook given with the budget data from the government, saying that this is what we mean. The main comments are many, but I just want to say that the non-uniformity in budget data is something that really gets to you, because not only are the items different across states, the definitions are different. There is no definition, right? I mean, we don't really know what it all means for Tamil Nadu versus UP versus Bihar. So we make our own interpretation. But the 3 things that I want to point out that I was told by my team again today is that the formats are different for the states. There's non-uniformity. For instance, the AFS in Bihar is very detailed, but the AFS for other states is not. So we don't have any detail, for instance, for Himachal Pradesh and UP, but Bihar is very detailed, so there is just no comparability. Minor heads vary. So Tamil Nadu includes water and sanitation in their budgets, but other states don't. So again, you don't have comparison there. For Himachal Pradesh, we found that other departments' expenditure was 10%, which was too high. It can't be true. So we are wondering what's going on. So there are all of these things that are very problematic when you're working as a researcher with the budget data. The very kind of a silly point that I want to make is that the data used to come in PDF format initially, right? Right now, they have started doing some Excel. Some states are sending Excel, but not all. And to get from the PDF to the Excel is like, it's a horrible exercise, and it shouldn't be like that. So obviously, the budget data is not supplied for researchers. It's really a very internal kind of thing. It's not at all user-friendly. The language, I think, is very important. Whether we like it or not, English is the language that is common across the country. And we have had problems interpreting the UP data because everything is in Hindi. And the names, I don't want to get into the language discussion here, but suffice to say that your guide, I hope you can extend it subsequently. Budgets should I mean, I think you'll have a discussion about input-based versus program-based budgeting subsequently. But I want to say that it is high time India moved away from input-based budgeting, line item budgets, to program-based budgets, so that if you are really serious about UHC, which I think is a question mark to me, if you're really serious about universal health coverage, we can't use these budget documents at all. We really need program-based budgeting so that you really know how much you're spending on universal health finance from all the sources, because health is only one department. There are so many other departments that are spending on health. We don't seem to be getting there at all. So right now, we have no good estimate of how much India spends on health coverage, for instance. I'll stop here and say that I really want to congratulate you, Avani and Owen and Rajesh, because this is really much overdue. And I hope you will continue to bring out additional annexures or something on specific topics under this broad area. Thank you.
Thank you so much. As I said, we've learned a lot from you as well. I think all the public finance researchers are always trading stories and sharing. I think it's also motivating when you are all struggling. I think most of us initially, before budgets were publicly available or even on the website, I think NIPFP was the congregation ground which used to get hard copies, and we'd all be there looking through the hard copies and trying to note down those numbers. Over to you, Rukmini. Would love your opening comments. Thank you so much for joining us.
Thank you. Thanks so much for having me. And it's such a pleasure to be at an event organized by CPR and the World Bank, two organizations that have done so much to the contribution of valuable public knowledge and public goods around all of these issues that we want to, that we're interested in. As someone who came into sort of development focused journalism without a background or without having studied these things, just spending afternoons reading research papers put out by CPR and World Bank was really how I learned things on the job. And when it comes to CPR in particular, I want to talk not just about the role that CPR has played in public life, but also in nurturing scholars, journalists, and others by providing resources in a way that's really, not comparable with any other organization I can think of. I think a good part of why I am here today to speak, despite not having a background in these areas, is because 10 years ago, when the budget came out, I would land up in Avani and Yamini's offices and tell them that I had no idea how to report on the budget, which then and now can seem like a real minefield for journalists who are interested in reporting about this but haven't been able to build expertise around it. And their sort of generous giving of their time and resources is why I have been over time able to build some expertise and be here today. So wanted to start by saying what all of us, and I in particular, owe CPR. The reason that I was there, in person trying to understand how to analyze budgets is partly because, as I said, this can be a minefield. And it is a minefield that sometimes plays out in very public ways. I remember, the 2014 change in budgeting structures, which Avani alluded to, resulted, for example, in an op-ed in the paper that I worked in at the time that said all schemes and budgets have been slashed by 80%, 90%, because essentially this was how the structure had changed, and it was, something that had to be retracted the next day. And I think what happens because of the way budgets are communicated in India, to me, it is, despite the fact that my job is to deal with Indian data that, can vary in levels of difficulty. And I don't think the budget is unique in that, but where the budget is unique is that it is a combination of a policy document and a data document in ways that are not the case in most other data sources that you deal with. So the fact that if you have not followed along and understood that the structure of the plan has changed means that a simple line by line analysis of data can lead you into absolutely, spectacularly incorrect directions is very different from any other data source at all that I work with. And I think what this does is one of two things. It stops well-meaning people from being able to engage with the budget. It means that journalists who are genuinely interested in working from scratch with budget data are so intimidated by the way it is laid out that they're not able to. And what I, feel particularly happy with the primer for is that I hope that it's able to do this, not just for journalists dealing with health data, but parts of it really have resonance for how budgets are structured across ministries. Just the fact that there is a clear explanation of what BE and RE mean in a way that you're not going to find anywhere else is going to give journalists in particular, steps for being able to analyze other budgets as well. So one of the things that it does, as I mentioned, is that it stops people from engaging with the budget. The other thing that it can do is turn people into unwilling propagandists, because if you are not able to analyze budget data on your own, you're forced to repeat talking points. And I think this is often seen as malfeasance on the part of journalists, but it could really come a lot from just the inability to work with data. And I think this applies very broadly across the board. There is, of course, malintent, but there is a lot of sheer inability as well. So, I hope that that a primer like this gives journalists who intend to work with the data themselves the ability to do this. Because taking the section in particular around the analysis of the budget, I truly appreciate. And again, I feel like this has come from years of Avani and her colleagues dealing with pretty much these questions, that these are the sorts of questions I want to answer. Where should I look for it in the budget? And I appreciate the very sort of user-friendly tone that takes, because if we think of the budget as a document that journalists and others should be able to use in their hands to answer, say, 10 big questions about how health financing works and the purposes for it. Thinking through these use cases to allow people to be able to answer these questions seems like a great way to start. So yeah, I have other thoughts and about analysis about things that we can do to make put more of this in the public domain, and how data structures of this PDF Excel sort can be solved for now. But just wanted to start with these thoughts.
Thank you so much, Rukmini. Honestly, your words mean a lot. I think I have former colleagues in the room as well, and current colleagues as well. And I think we've all, I think words of yours is what keeps us motivated. And during budget time in particular, I think when most of us are struggling to have sleepless nights, and I think this is the first year, I think, where we're getting that 26th January long weekend. Otherwise, most of us are working from home, but trying to make sense of budget documents. So thank you so much. That really means a lot. Maybe we can come to some of the difficult questions. I wanted to start with Ms. Rao. I think we've all talked about how complex budgets are. But why? As someone who has worked in government, I think it's a question that we're always wondering, that what are there any reasons why budgets can't be made more reader friendly? I was once told by someone that actually your budgets are not meant to be for researchers. They are an accounting tool, and so should be kept like that. But then others have also, including government officials, many have also said that there is a need to simplify, there is a need to get more citizens involved. And I know that even the union government was trying to do an exercise. I think if you look at 15, 20 years back and now, there are attempts to simplify the budget for citizens. You have explainer videos, you have a few of these one-pagers and budget at a glance. So I guess the question that we all wonder is why? Is there a reason why budgets are so complex, or is it just something that hasn't changed in many years?
Avani, the real truth of the matter is that in all these years, the budget has only been seen as an accounting tool. Finance Ministry just simply and clearly wants to know where every rupee has gone and on what it has spent, So therefore, any reform in the budget will immediately raise hackles from them, because they get very insecure, saying, my God, if you give a global budget or if you give a bundle budget or something, how do we know that those people are not diverting it and siphoning it off and sending something, this kind of, so constantly it's a tussle, even under the centrally sponsored schemes, for states who want something and that's not reflected in the line budget of the central government. So they have to keep manipulating under the different definitions to get what they want. So I personally have always felt that the budgets require a complete revamping. Not only simplification, I think budget is much more, I would say that it's, no, don't get me wrong. I don't think it's primarily the purpose of government to have a budget is not so much to make it easier for civil society or journalists or researchers. It is for itself. It's a budget to see what am I doing with my resources and where is that money going. So it's a control mechanism. So every secretary or anyone must have a budget. They must know. You can't have a single page and say, here's 84,000 crores and you spend it broadly on hospitals and primary care and leave it at that. No, that will not work. So there has to be some amount of specifying on what you spend, like, how much do we spend on childhood vaccine? It has to be budgeted for, because based on that, you do your procurement. Now, behind how much of the figure you put there, there's a whole back-end exercise that's done as to see what is the consumption, what is the requirement, what is the target group, and how much did we utilize last year, and so on and so forth. So there is some amount of an exercise done, but problem comes in is when it becomes so detailed to the last minute, the changes from one head to another head is enormously difficult. So that's one area where I think, when broad outlines are given, from there, you can give some amount of flexibility, if not wholly, at least a 10-20% flexibility to the users to say you can change and then report back, and then you replan, you rebudget the whole thing to what was a realistic level. But essentially, it is a control tool. Let's be very clear on that. And will it ever change? I mean, we don't have district budgets. For example, you mentioned that Maharashtra has. I didn't know that. But we don't have district budgets. We just have only state level. And then we have these different routes. The more decentralized you get, the tougher it is to understand where the money is going and on what. For example, your Kerala gives 1/3 of the budget to the Gram Panchayats. I have still now not been able to, and if you want to know what exactly that 1/3 of the health budget has been spent by the Gram Panchayat, oh my goodness, it's a nightmare of a program, because you have to go to every Gram Panchayat, sit with a finance guy and say, what did you spend it on? Because that's a flexibility given to the Gram Panchayat. But then at another point of view, that's the way it should be, because they're really responding to people's need. And, so if you give a prescriptive thing saying only you can spend on equipment, and then all of them will be sounding the same. So, and you'll be spending money where it's not required. So these are the kind of issues. Where do you get the balancing, and how do you enable a budget to be reflecting, enable the finance control to see that you're not overspending on something, because you know how politically it can be distorted. You might want to spend it on something and the politician wants it on buildings. The whole budget can just go on constructing buildings or buying equipment where there's a rent feasibility there, So therefore, while I do admit that there will be always some amount of an accounting requirement and a control mechanism in the budget, but at the same time, we have to work out the balance where there's some amount of flexibility at the implementation level that has to be provided for, and more realistic budgeting should be made possible. I don't know if I've answered your question, but it's something along those lines.
No, definitely. Thank you so much. I'm reminded of when, I think it was Rajasthan that had devolved midday meal to panchayats. And again, the same problem. In some ways, it's great. We all argue for decentralization. But when you're trying to then aggregate and figure out how much money has been going for midday meal, it goes into a head that says assistance to local bodies. But beyond that, you don't get any other details.
Have you ever seen... have you ever tried to get to know what the Gram Panchayats do with the 10,000 rupees we give under NRHM? How many DDOs? One state will have some 10,000 DDOs. Now, how do you get to them? They all spend it on some malarial, spraying DDT powder or something. But how do you get, the smaller the account, the tougher it is.
So true. Would love to get you in because you touched upon this a little bit about input-based budgeting and program. And I guess what is your wish list in some ways, where right now I think there's always this tussle between, and I've heard this before as well, how much should the budget actually allow you to be catered to researchers, but even if it's catered to programmatic people, what needs to change? And we've heard this many times that okay, it's all standardized till the minor head level. As you also said, it's not always the case. There's a reason that in a federal and decentralized country like India, to have everything in a standardized way is also problematic. We all against the one size fits all model. So what would be your wish list as someone who has dealt with this several times? And I'm sure you have thoughts.
Thank you, Avani. Gosh, there's a lot to say actually, so I don't know where to begin. Even if it is an accountability document, I don't think that the government is doing a very good job of this because you're not doing it all the levels. So Sujata just said how the panchayat budgets are so difficult to unpack. We are trying to understand how the urban local bodies spend anything, whatever little they have. We just don't have any clue. We just can't do this kind of exercises. So that's one thing. So as an accountability tool also, whether the government is doing a great job is very doubtful because of all the problems we've mentioned since the beginning of this meeting. It's the nice thing about being invited to such things is that you do a little bit of homework. So I was just trying to see which countries have actually moved towards program-based budgeting. And there are countries that have done that. I mean, and many countries are in Africa, they've done that. I also in Latin America, there's Peru and I have Kyrgyzstan from former Soviet Union group. But one thing that is very clear is that it takes a lot of time and effort to move from an input-based budgeting, line item-based budgeting to a program-based budgeting. Now, the question is, the main question, Avani, is apart from accountability, which the government must have. I mean, I don't think we're going to take away from that. The government must know how much it's spending on what. And if this suits them, then so be it. But what else do we want to know? What do we want from the budget is the main question. And I think there are many questions we can ask. But one thing is that where are we in the health sector today in the health financing scenario? We are all trying to move towards universal health coverage, right? So, and we need to know how much are we spending? How much should we spend? Are we spending efficiently? And are we meeting our goals? I mean, those are the four simple things that I'm just on the top of my mind, I'm saying. Why are we not able to even get an amount that India spends on universal health coverage? We've all done our back of the envelope calculation, either say, we've done this, that, and the other, but it should be easier than that, right? Now, programmatic budgeting means that you have these 3 or 4 major programs. Forget the minor ones. If you can't do them, fine. But the big programs that you're implementing in the country, including PMJ, NHM, TB, etc. I mean, all of that, the budget should be tailor-made to answer questions around those programs. So the programmatic ones asks you specifically, for instance, if I want to know how much does India spend per beneficiary on health coverage, you can't get it from your budget documents. You just can't. You need to then look at ESIC, you can do railways, you have to look at defense, everything together. So my point is that can we move from this kind of accounting, which it's not this or the other. I think this is in addition to this. Can we also do programmatic accounting of how much we are spending? Now, if you have NHA, National Health Authority, that's doing PMJ, and you have Ministry of Health doing other things, it just doesn't really work. It has to come together, but it's not coming together. So none of us really know what this new system is. Now, if you have a provider payment system which is separate from every other system that you have in the country, then you have a problem right there, right? So PMJ has got these nice packages, but then the other health coverage programs don't. And how do we make sense of any of this? So my response is really that we cannot decide this in this room. Obviously, it's a very high level decision that the Ministry of Finance, all the ministries have to sit together and make, whether they really want to introduce program-based budgeting, because that is going to take a long time. It has to be a shift that has to be incremental, but it has to happen. And I hope that your work and all of our joint heads can be put together to will the government, propel the government towards program-based budgeting, moving away from input-based budgeting. If they want to do it, they can continue doing that, but they need to at least tell us what is being spent on the main programs of the government. If I'm very optimistic, I can say we can bring in performance indicators. Some countries have done that as well, but that I think we're very far away from that. So we won't even discuss that today, but at least move away from the listing your items to what are the major programs that you have around which you have planned. Your health document, your health planning document has all these strategic programs. Let us know how we can actually cost those and see how much is being spent around those programs. So that's what I meant. I don't know whether I've answered your question.
Another project, Rajesh, getting a working group together to brainstorm collectively, I think is in the making. I was wondering if I could bring Rukmini in. You've not just looked at budget data, but looked at lots of data. As a data journalist, I think so much of your work is actually just trying to make sense of different data sets. And I was just wondering if there are lessons that you've seen or other data sets that provide us, I guess, opportunity to think about how we could improve just health fiscal data, for the lack of a better word. I'm not using health financing because I know that goes into a completely different territory, but I'm not also limiting it just to budget data. I think we've also learned that often, whether it's getting per beneficiary, per citizen, the second you need to actually answer a story, you often need to merge different data sets together. Some of our costing work has required us to use census data, make projections, looking at NFHS, making projections, trying to understand how many people we probably have since we don't have a census for a while now. So would love your thoughts on anything that you could teach us and tell us of platforms that exist or data sets that could be used better, or any of your own experiences of trying to pull together different data sources to tell a story.
Yeah, thanks for that. When I saw the line in the primer that said, don't mix data sets, I thought, oh my God, my job is in peril now because I mix data sets all the time. I get it in the context of budget data and how that would be particularly dangerous. But it, this point about looking at multiple indicators at the same time sort of brings me to how I'm thinking about your question. So I think the challenge here is, and this is really very widely shared across the Indian data landscape, is at two levels. There is data access and then there is data analysis. And I don't necessarily think the same people doing all of it at the same time is necessary. On the data access part of it, a lot of things that were problems 10 or even 5 years ago are being solved very quickly and being solved by people who may not be traditional allies, but who are people who we should more and more reach out to. Now, if you just look at covid19india.org that was set up, within weeks of the first few cases. If we talk about how it came together completely completely voluntarily and pro bono by a group of people who had these skills, knew what to do, and wanted to pull it together. And what was the problem statement here? The problem statement was not to try and crowdsource data, do analysis, make models, none of that. It was that bulletins exist for every state government, and each bulletin is giving you district-wise data for that state. But there isn't yet a national website that pulls together all of these bulletins, which would allow you to construct timelines and would allow you to do district level data. So granularity at the level of time and granularity at the level of district. And what does it involve from a tech perspective? It involves converting PDF into Excel and putting it into a backend, make it queryable, and put the charting on top of it. And you can't throw a brick in a Bangalore coffee shop without hitting like 5 people who can do this now, right? So these are all solved and solvable problems, and more of us should spend less time on this, because this stuff is fixable quickly. This, where the data exists and needs to be put into formats that are not just user friendly but fun to use. I mean, COVID-19 India.org genuinely became a place that people enjoyed going to look at. For data, it wasn't one of those turgid government websites. So on the data access side, I want to encourage all of us to tap in much more into India's open data community that has the skills as well as the public spiritedness and the sort of non-partisan let's get things done sentiment to get this sort of stuff done. So we have open budgets, for example, built by Civic Data Lab as one way to think about how we could bring together, this sort of data. There's much more we could think about. The levels of analysis and querying that everyone here is talking about is not necessarily what open budgets does already, and so we can think about ways that can get better. I think the analysis part of it should happen separately and by other people. When the data is made easy to access and use, it allows people to do this sort of, let me satisfy my own curiosity, let me fact check something that I've read in the newspaper, sort of, let me build a chart or a table for my own, MA paper sort of work. That's really important. Separately, the sort of hand-holding through key issues, that is the sort of vital work that Accountability Initiative has produced, for example, over the years, I think needs to happen separately. Then the concern about how to make all of this backend data available, how to make it accessible, what to do with Excel doesn't become your problem. And then you're able to sort of build things like not just analysis, but also this primer. I will say, though, that when it comes to budgets, even with the primer, since it is so dependent on immediate policy decisions, so literally a decision announced in the speech will be then reflected in the document that is available minutes later, I would still encourage a level of handholding with early analysis that I don't necessarily always urge people to do. So I would want people to be able to build skills and capacity to do things themselves. But because of the way budgets work in particular, where some key difference in accounting might be announced that day, or a scheme being wound up but replaced by something else, so that you don't make your headline scheme wound up and not the rest of it. I do think that this is not something where I feel like the primer should help us understand all that went before and build capacity for what's coming, but we still need to think about handholding and strengthening on the day and soon after the budget. It's just because of the sort of very nature of how this exists. So whether it means what CPR has always done, which is make people available to sort of help those doing analysis understand what's coming on that day. I think that part of it will remain essential until there isn't, until we reach a point where there isn't volatility in how, maybe when we reach Professor Indrani's wish list, where things are sort of in an expected way progressing along programs, and so you can leave people safely to do this analysis on their own. So yeah, just lots of silver linings in terms of data access. leaving aside the data collection part that needs to happen, but in terms of data that already exists, lots of silver linings in terms of access, which we should all, we should not replicate work that's going out there. We should reach out to people doing this sort of work who can do it much faster and much better than any of us would.
Thank you so much. Yes, access is a really it's an interesting one, and I feel like bringing in Miss Rao here because it's something that is always, as Rukmini said, there are now so many different tools and ways of, particularly amongst civil society organizations, researchers, of trying to take those complicated PDFs and put them into Excel. But I'm just wondering, and I would love your thoughts on why is government, I guess, not doing that? And we've seen that on one hand, state budgets are online, but the second we want to look at, say, the NHM financial management reports. I think for 1 year, 2016-17, they were online in Excel, and we all quickly downloaded them for all states. Subsequently, they have never been online. And I remember talking to a budget officer from a state, asking him that you take the Excels and you then PDF them, then you scan them. Why not just put the Excels online? Sikkim does it. Many other states do it. And there was a fear that the data could be manipulated. But to be honest, I didn't quite understand that, because it can be manipulated, as in you put out what you put out, people can manipulate it, but that's on them. Your original document is still publicly available. But I guess just wondering, would love your thoughts on what is the access barrier, because there is a lot of efforts. You have the national data policy, you have a lot of state governments coming up with their own data policy, so there's clearly an interest. You have data .gov, all of which are government initiatives, but yet when it comes to utilization statements, some of these financial expenditure records, audit reports, exactly, state health society audit reports, they aren't publicly available. And I know that we trouble a lot of people by filing RTIs and getting them. I think Ritvik has gone many times with a pen drive and collected these very, very heavy files. But why, I guess, and especially in this day and age where someone or the other is doing it?
Avani, there are just 2 points. Before I come to your question, the earlier discussion, I somehow got the impression that, we are confusing the budget document with an NHA. The NHA is the one which will really tell you the entire expenditure, give you a flavor of what all is being spent, and along with NSS, so consumer expenditures, gives you a full picture and a map of what is going where, who's spending where, and so on. Whereas a budget is a completely government's accounting tool. It cannot expect the government's budget document to be telling you all the other things, how much is NFHS doing, what is this tool and that tool. That's for the researchers to triangulate data from different sources to make a sense. And budget document is only one of the many documents that you look at to make the whole story. So, and when Indrani has mentioned this twice, that, UHC, I want to know how much has been spent. Today, UHC itself, what do we mean by UHC? Is there a definition? If you take SDGs, they're saying essential healthcare. Somebody says all services, that means even a liver transplant would qualify as UHC. So, unless and until there's clarity in our own minds as to what services are included under UHC, then maybe you can try and get hang around. But that too, what government is spending through its budget. But to get the entire picture, one will have to go in for an NHA kind of a tool of analysis. Now, why are documents not being made public? I think, Avani, today it's getting tougher. In my time, it was much easier and you found that difficult. Now it's even tougher to get any data. Even published data, which is routinely should be available, was available in my time. Today, it's very difficult to get. That's one part of the question. The second is the reason why many of the concurrent reports are not put online is because they do change. There is, you have to understand the enormity of the task when the final figures come in. So utilization certificate you will give to fulfill the central government's requirement and say, this is, money received, utilized, done. For example, central government, any money that's released to a state government is seen as utilized. Whereas the state government is still probably sitting in the finance ministry. It has not even gone to the implementing agencies. So all these things have to be really ironed out, and FMR and all of them are living documents. But I do agree with you to whatever audit reports of SHRCs and all that should be made available and can be made transparent. It's only, I really don't know why, because I would have made it transparent. I don't see any reason why it can't. But in all this, the real figure which tells you the story is the final estimates, the accounts. And that is where, but that's always 2 years old. And whenever I look at a budget document, I look at those figures and compare with what's happening, taking them, because all budget estimates and REs are constantly changing document to document. But a final estimate is a finally audited, finally spent, and it gives you the more accurate picture to know what really was spent finally on the health sector. But to your question, why are they not put in the public domain is just, I think, a fear. Government believes in holding on to information. Information is power, so they probably don't want to reveal it unless and until it has been finally sanitized or finally verified to be correct and accurate, because it can be quoted by different people. I mean, this is the only answer I can give for why is it not being put on the public domain.
Thank you so much. Would you like to respond?
It's not put in the public
No, not to that. In case you, Ms. Rao, to her comments on the NHA versus the.
Yeah, no, so my main points I was trying to make was that how much do we spend on health and how much do we spend on health coverage? So I'm saying that you have to triangulate the systems that exist. I'm not saying, Sujata is right. I mean, you can't, that's a different system altogether, but the relevant portions from that system can actually be in a new kind of a approach. I mean, so this is not available. It won't be available in the current system that we have. But if you really need to know how much we are spending on health coverage, then a similar reporting format for all the health coverage programs need to happen. Maybe that, if you are saying that health coverage includes this, she's absolutely, Sujata is right. You first have to define what is health coverage. And then once you've defined those 5 or 6 items, then you have to report those items and see how much you're spending. So that way the triangulation is essential between the different systems that exist in the government for budgeting. So that's what I wanted to say.
Okay. I was wondering, we're coming, for those online, please do put in your Q&A in the Q&A box. We'll do quick round, and I wanted to pass on the mic to you to take the last set of questions from our panelists before we open it up to audience questions.
Okay, so let me begin with Dr. Indrani. I think a few years back, we were working together on some of the NHM data and also trying to look at, different levels of expenditure for different levels of healthcare. You've talked of challenges related to the form and shape in which the budget documents are available. But what are some of the challenges you are experiencing when we are looking at analyzing health expenditure by levels of care? Let's say primary, secondary, or tertiary.
We've all been the same. So I just wanted to share with you that there was an attempt, apart from the other stuff that we were doing with this under this project, to classify expenditure into 6 categories. We thought we'll do primary, secondary, tertiary, medical education, social security for health, and administration separately. Completely, I should now say that it was a very difficult exercise. Now we have these 4 heads, major heads, sub-major, etc. So we could actually, based on these 4 rows, it was possible to understand the exact nature for about half of the items. Because, you know, they said my administration, so we put it under administration. There's a social security, we put it under social security, etc. But for the remaining cases, there was, we just could not do it. It was very ambiguous. So, I mean, our exercise is an example of how many assumptions you have to make to classify items under P, S, and T, and even medical education, for instance. So the straightforward cases we were doing, but we had to also do it for the ambiguous cases. Now, I'll give you one example of the hospitals. Now, hospitals spend on P as primary, secondary, and tertiary, right? And there is no easy way to actually unpack that. So what we had to do, and this is exactly where different data sources come in, Avani, you can't get away from that. So we went to the, and very few hospitals put up their detailed budgets online. AIMS did at that point, I'm talking about 3-4 years ago. And so we looked at the AIMS detailed budget. We kind of, Avantika sat and looked at OPD, footfalls, IBD. It was a horrendous exercise, but very stimulating also. And we got those proportions out, you know. So we then use those proportions to, you know, say this is P and this is S and this is T in the total hospital expenditure that we had. But we knew while we would, and we're still doing that kind of thing, by the way, because, you know, we have the grant is on and we're just doing it, and we're trying to build up a whole series of estimates, guesstimates. But my point is that primary, how much in India spends on primary, secondary, and tertiary is it essentially a very important question. I mean, it shouldn't be left to researchers like us to plow through data and figure it out. So coming back to some of your earlier questions, isn't there a way we can get the budget to classify, or at least give us definitions of what comprises primary, secondary, and tertiary, so that we can then do it? Sometimes we have to go Google search a particular institute to even understand what those institutes are, because we really didn't know, you know, what these are. So that example is essentially an example of how difficult it is to get important aggregates out of the budget, when PST is absolutely a basic thing that we should be able to do. So yeah, I don't know whether that answers your question.
It does. I mean, let me just add, you know, one more layer of complexity to this. While, you know, fully agree with the challenges you talked of related to primary, secondary, and tertiary classification, from a policy point of view, if we are looking at combining the functional classification and the economic classification, for example, how much are we spending on drugs for primary care? Life becomes even more difficult. And let's say if out of 800 crores allocated for drugs, is most of them going for, you know, tertiary or medical colleges, that makes it extremely, extremely challenging.
Rajesh, I differ with you. I think in most states, they all know what is the drug budget for primary healthcare centers. Sub-center, primary healthcare centers, and CHCs are seen as primary care. So whatever the drugs go there, and vaccines go there, are taken as for primary care. The problem is, as Indrani was saying, in a hospital setting, yes, there is every tertiary doctor is doing a primary function. He's also a secondary, and there's also super specialty kind of a function being done there. So a functional analysis of a tertiary hospital is not at all, and apportionment of budget accordingly is not at all possible. You can only get a broad heading, I think.
True, you're right, Ms. Rao. I mean, you know, most of the states give that classification. The problem lies around the interstate variations that we talked of. For example, I mean, you know, you would have one state where you would not have an object code on drugs, for example.
Yeah.
If you have that, then you know how much is drugs for PHC, drugs for CHC, and drugs for, let's say, a district hospital. But then, I mean, a state like Nagaland, for example, would have, instead of an object code classification on drugs, would have a functional classification saying purchase of drugs.
But that's
and
where
then we
the
don't know.
standardization. Yeah, that's
Right.
where the standardization.
That's where the
issue comes in,
standardization
what
comes in.
Indrani had mentioned. Yeah.
True, true.
We were doing some costing for health and wellness centers in Gujarat, and we needed to know how much they spend on drugs, but it wasn't really easy because the sources were 3 or 4, and we could not understand whether they were all being went for HWCs or they were going for other centers. So I think your problem would still remain if we ask a question which is a little deeper. Yeah. So how much do the HWC initiative, how much do we spend on personnel, and how personnel is easier because there's only one medical officer sitting there. But yes and no. I mean, there is also apportionment of other people's time and all of that. So that becomes a costing exercise. But for drugs also, it wasn't very easy. We had to sit with lists of medicines to figure out how much is the HWC actually incurring now. Yeah, at the facility level.
And then it makes it more complex because at least half, if not more, of the total expenditure on drugs, for example, comes through NHM, right? And through medical college.
No, but that you have to do by triangulating. There's a program, there's a detailed and guideline of the program. What drugs ought to be available in a sub-center, what drugs ought to be available in a PHC. So, but then this has to be done facility-wise. You'll have to see and say what has been supplied, or even a state government or a district level will be able to tell you what drugs have been dispatched to sub-centers and PHCs. But it can be obtained. I mean, I don't think that's a problem. But overall, trying to get a hang of how much are we spending on primary care continues to be problematic, because like a scheduled caste subplan doesn't give any details. Tribal subplan again has health budget, but they also have a women and child. They also have the whole tribal subplan itself, which is a pool, and they have the discretion to spend on whatever they want. So it is very, very complex. Yes.
Do you think, I mean, Ms. Rao, from a government's point of view, while it will take its own time to look at, shift from input-based to program-based budgeting, as Dr. Indrani was talking of, for the interim period, do you think a kind of, IT dashboard where an algorithm is worked out to the extent possible, and that pulls data out from the, let's say the budget sources, to give a broad idea about all these estimates, like primary,
How?
secondary, and tertiary
No,
care?
but
Is
how
that
will you
possible?
how will you do it? Like I was saying, even in tribal areas, the tribal project officer of that ITDA has huge funds which are discretionary to him. He may spend it on health if he thinks it's important, or may not. The health budget data is only a small input of overall what is being spent on the health of the tribals. So that's not anywhere for an algorithm to pull out. So the first step that has to be done on budgetary reform is to standardize the heads, remove a whole lot of nonsensical heads which are useless, not required, and simplify the structure itself without, sacrificing the financial ministry's obsession with control. So that is the first step to be done. And once you get all the states to put it in that form, then your suggestion for trying to get some kind of consistency and an algorithm to draw it out from different places can be done. For example, in the central government, we didn't know, we wanted to know how much we were spending on public employees, central government employees. So we had only our CGHS in the Ministry of Health. But in order to know how much defense was spending, labor was spending, other departments, because all departments can spend on the reimbursement of the health of their employees. So we insisted on creating a budget subhead where they would put all the health expenditures incurred on their employees in every department. So all the 30, 40 departments, you'll get the subhead, and you can then calculate it together to say central government spends so much money on reimbursing hospital expenditures or whatever it is. So some amount of reform on what is the data that is useful for us, and take out all the redundant data and standardize it and make every state follow that as a minimum requirement for getting any central government funding or anything like that. I think that is the first step to be done. They can have it in Hindi, English, or whatever, but they should have it in dual language, English and the state language. I think that's absolute must.
Yeah,
And I tell
thanks.
you one thing, some states don't have that kind of skill to do it. So there's a lot more training also to be done at the state level to build capacity to do the budgeting, to make budget documents.
One, I think we're going to start definitely making that working group. And I think everyone here, please join in. I had a last question for Rukmini. I think one of the things that we all have learned from data journalists such as you yourself is I have our communications colleague always tells me, Avni, stop putting on a researcher hat. Stop thinking like a public finance person. How do you simplify things? Tell it to me like I would understand. So any tips? And I think you did mention that, and I think we also recognize that the primer is just a first step. You do need additional hand holding, I think was the word you used. But any tips for us who are the public finance researchers, but also for many other researchers in the room, of how do you simplify things? Since some of I think what's come out from this discussion is that the onus is still going to be to some degree on researchers. I think it's going to take a while for us to create that hub, as it were. But yeah, any advice of how to do a better job of telling the story?
Thanks. So one sort of broad thing that again goes beyond budgets and has generally been my advice to some people, to people working with socioeconomic data in general, is that sometimes there is a lack of imagination in asking questions that comes from some amount of groupthink around what is important. So the 3 or 4 questions that are typically assumed to be the axes of analysis for budgets, which is, has allocation for this gone up or down, those sorts of things are important, but I think there is some amount of reimagination that needs to happen broadly about the questions we ask from socioeconomic data. And the more I talk to people who do not, students and others who do not typically engage with research around this, but are interested in the questions, is that it brings you back to questions around what is this data here for? What is it meant to answer? And how can it sort of substantially add to people's understanding of of the country? So I feel this similarly around, just today I was looking at labor data, for example, and there are, some of these categories come from the data and have just become ossified over time, right? So anyone who works with labor data knows that you'll immediately reach for 2 or 3 things, which is self-employed versus salaried versus casual workers, and repeatedly using those conceptual categories without communicating why those matter, or why they are important axes, or maybe they don't need to be important axes for the particular thing you're talking about, then is the sort of rethinking of existing categories that I do wish we would all do more of. So I think some amount of engagement with maybe students and other people to understand what they would like to get out of budget data, what do they feel that this is a way to try and understand how policy priorities work? Do they feel this is a way to understand how taxes are spent? Or do they feel not or is this a way to understand how allocations for different schemes may change? Is something that it's good to not assume and perhaps do a better job of trying to understand what people would like to get out of the budget. In terms of communicating this, similarly, I would say one thing is to sort of not throw out, but at least do some juggling around existing categories and see whether they are always useful or not. So things like both allocations as well as flows of money can sometimes be a bit, it's not always apparent why it is an important dimension to be studying. And to the people one step ahead of you. So, beyond you in the information chain. So let's say maybe your comms people or even to journalists who are going to use this research. Ultimately, I think what always becomes very apparent with budget communication is that if you've not fully understood it, you're not going to be able to do a very good job of communicating. And I know this from having not understood and not done a good job of communicating. When you know that you're not entirely clear what this means, you're going to end up sort of repeating uh, terms without being able to fully explain them. So I agree that thinking of it as someone who's sitting across the table and you're explaining to them works. I think when people take it too far by saying, explain it to me like I'm 6, that isn't how it needs to be at all. I don't think any of this needs to involve dumbing down. But yeah, so two or three broad things. One is try and understand what people really are using this information for, and not the same dimensions that we have always analyzed something on, and make sure that someone really understands what they're talking about before communicating it. Sorry, and just to broadly say, I think there is very broad interest in budgets, a lot of interest in how government spends money, a lot of interest in what happens with tax data, tax money. So the more we tap into that, there is that interest, particularly, I mean, often it comes from a very entitled position of what is my or my parents' tax money doing, but tapping into that interest is something we should all try to do.
Thank you so much. Sorry, you wanted to say something? Yeah, after that, we should open it up for a very patient audience, both online. I've got some questions.
Just a very quick question, point is that the first thing I think we need in this kind of a document is a definition of health, because we have seen how the very definition keeps changing and you get different numbers, 126%, etc. And I think it's a very important point. I mean, I don't know how it has to be done, whether it has to be done in consultation with the government, because if the government thinks that water, sanitation and nutrition should be included, then who are we to say no? But the issue is that the reason I spoke up is because when Rukmini is talking about communication, etc., I remember somebody from a particular newspaper kept on contacting me saying that I can't make sense of this 126%. Is it really that or not? I think the boundaries have to be also stated in a primer like this. What is it that you include in health?
Thank you all so much. Opening it up to the audience, we've got yes, we'll take one from online because I know that there lots of people have questions online as well. Go ahead. Yes.
I just wanted to ask, my name is Parth, and I just wanted to ask if there is any program in the country that is doing it well with respect to budgeting. For example, if you look at the National Tobacco Control Program, we know it's 100% on, at least on paper, funded by the central government. There's budget for the state for 40 lakhs per annum, for each district 40 lakhs per annum, and the utilization certificate is also pretty well defined. And it's uniform for all the districts. So if you have studied that program and if you have any insights to share, if there is any other program which is doing well or any state which is particularly doing well. In terms of
putting the information out in a easy to understand manner. Huh? I was going to say, but that's not a health example.
No, I mean, we have it in other sectors. I mean, Manrega clearly is one example. Dr. Indrani or our colleagues from the governance unit, if you looked at any other sectors, that will be helpful.
It's interesting that Manrega also had a lot of civil society organizations involved in trying to make it accessible. But definitely it's one where you can drill down till the Gram Panchayat level. It's all easily downloadable on Excel, and that's why there's a lot of work that's happened. That always stands out as one of the better MIS systems.
I don't know whether Sujata would agree. Maybe the NSCP, the National AIDS Control Program, because it started off by giving a lot of details. I don't know whether it still does that, but Sujata might be able to say.
If you're saying in terms of public information, yes. I don't know about now, but it certainly was the convention in NACO to keep everything out in the public domain. But then, NACO figures really are a triangulation of various sources. And our difficulty was the donors. Donors at one time were dominant financiers of health. At that time, it was very difficult to get. Now it's all straightforward central budget. It's there's no state budget involvement because it's completely a center sector scheme. It's not a CSS. So with the result, it's easier to capture what's happened by just looking at NACO figures state-wise. It's only when the sharing business comes in that becomes a problem. As you know, pointed out in your own document, where the states are supposed to give 40%, that varies, doesn't, it's not always uniform, and central grants are also not so uniform, and so on and so forth.
I'll take a few questions that are online.
And besides, also, Avani, in our budget, when we say, you know, how much are we spending on a program, we look at the under the CSS, we only look at the total financial envelope that's been given by the central government, like 60% and state on the 40%, you know. But we don't calculate how much more state government is spending on the infrastructure, on the personnel that are implementing the projects and all that. So if you really do a whole costing of how much the state government has invested in on the TB officer, on the TB vehicle, on the and so on and so forth, which is state funded, the state share would be much more. And that sort of analysis is really required, because we just get away with the thinking that central government is giving 60% and state is giving 40%. And that goes for NACO as well, because we use the whole government infrastructure to implement our programs. And that ought to be really costed. And there's no system of doing that in our financing methodologies.
I think you kind of answered, but there's a question directed to you, Ms. Rao, which is, it's well known that budget allocations for mental health care are minuscule. This is by Mr. Ajay Gulzar. But what no one talks about is that even these minuscule allocations are not spent. Only 5 states in India spent over 50% of the budget under district mental health program between 14 and 20. 20 is the last year for which the data was available. Delhi spent only 0.000079%.
Right. Absolutely right.
Why is the central government not asking the states to fully spend the budget? It's just 84 lakh per district.
No, right. He's right. We are not spending anything on mental health. Even the budgeted amounts, which itself are a shamefully small number. And why they're not doing it? Because some of the DMHP program is very psychiatric centered program at the district hospital. And the state government say Jharkhand, which psychiatrist is available there? So you can't even implement the program, frankly speaking. So sometimes those kind of bottlenecks also come in. But it is a very poorly implemented program. That's true.
But at the same time, I think, as you also said, that centrally, I think the mistake that we all make is that we think that centrally sponsored schemes are the only mechanism. And there's often interesting thing that some states are doing, not specifically just for mental health, but generally, I feel like we often miss out on the fact that many states are running interesting, innovative programs that often get missed out of because of the fact that we're not able to look at their budgets properly.
Absolutely. If you see Kerala's primary healthcare, they're spending far, far, far more than what you will get if you study the central budgets to try and get the hang of what has been spent on primary healthcare, all the state subjects. Because the Gram Panchayats is spending a lot. There's a lot happening there. So it's not possible to get the entire thing from just the budget documents.
I'll take a question here, Smriti. Yeah.
So I want to have, ask this question from on the budgets, but from the program and when are we audible? Is she audible? Move the mic closer. So from the program side and also then from the policy side. So the question is, and Ms. Rao, I think you could answer. I think I do know the answer, but does the government itself understand I mean, from programmatically, because exactly this question, I'm recalling these PIP and ROP discussions where the central government is pulling up, in various programs, health, that, the data, the budget is unspent. So my question is, budgets definitely are a programmatic tool as well. So does government kind of itself understand where the budget is going in an agile manner? And in that sense, are researchers then, is there a scenario where researchers don't hope that exercises like this are looked at by the government, but actually ally with the government to kind of do an agile analysis? I've seen bureaucrats, even including DMs, looking at dashboards from the program perspective and saying and pulling departments up that this is not happening or that is not happening. So the question is the government machinery, forget about the transparency and the complexity, whatever of it, is it understood by the government machinery, state departments, districts, to understand how the program is doing? That is one. And a follow-up here is that after COVID, especially, I mean, COVID put a huge spotlight on non-communicable diseases, diabetes and obesity. So, and this is coming from all the ROI studies that, I've seen ECD and, all these that employee well-being studies that, the ROI of the money spent. So is the government able to kind of also analyze that, what is the most efficient and effective way in which shapes the policy then? Because in NCDs, and this is particularly just in NCDs, I do see a lot of screening now happening, but again, the preventive side of it. So does government understand the budget programmatically and also in terms of the returns so that it can feed into the policy? Ms. Rao and I think all the researchers who have looked at it, I know PESA, when the PESA was done, there were some insights from the frontline. So
Before Ms. Rao, I
question.
was wondering if Rukmini could come in, because I know Rukmini has to leave. So your parting response to Smriti's question, and thank you again for being here. Before we
Not
open
at-
it.
Yeah, not at all. Sorry, I have to drop off, and I'm absolutely not the right person for Smriti's question. So rather than walk into territory that I'm unfamiliar with, I'll just end by saying that I'm very happy to have this primer. There's parts of it that I'm going to have to go through myself, because I know that there are key parts in analyzing budget stuff that even I'm unfamiliar with. As I said, I'm sure people are going to use this for other budget work too. And I look forward to seeing what we can do with this on budget day. Let's hope that there isn't some other massive reorganization and that this holds for a long time and not for this budget alone. But yeah, thanks very much for having me, and good luck.
Thank you so much for joining in. I know we're running late, so we will try and maybe we should take a few questions together. But this was a long one, so maybe let's get the response. Ms. Rao?
Yeah, question may be long, but I don't think my answer is going to be very long. The answer to that question, Smriti, is that of course the government program officers know very well what's happening and what's not happening and what's clicking. That it's unfair to say that they're clueless. That's not true. They know very well, but they're quite helpless. You have to understand that, when NRHM was designed, there was a deliberate policy shift to say we'll set up these independent autonomous units like SHRC, and the central government will have this PIP and all that. But once decided, the check will be out to the SHRC. And and in fact, not only that, but once they gave us the district-wise allocations, money from Delhi used to go straight to the district authorities, and I would know that it has gone that very day, morning and afternoon. I know it's reached. So when that kind of system of quick releases program-wise was made, utilization was far, far better. But even then, in states like Jharkhand, for example, there was quite a lot of money earmarked for, say, capital construction, and they just didn't have any contractors or that capacity to make so many buildings and spend that kind of money, how to tender a document, how to do the procurement of the contract agencies and so on and so forth. So then we had to say that why didn't you use NDCC and so on. So there are various reasons why money is not utilized. And it has become particularly complex now with the treasury stepping in. And today, when each state government is very, very tight on resources, there's huge amount of competitive populism going on. There are deliberately the money that is released by the state central government is not released to the department, and from the department doesn't go to the head of the department. From there, it has to go to the DDO, or from the DDO, it has to go to the DMHO, who then gives it to the PHCs to spend. So, this whole chain, by the time it's done, the massive delays in release of funds. And once you get these massive delays, money is released, say, on 30th of March, obviously it will be shown as unspent. The next year, the finance department cuts your budget and says, you never spent your money that we allocated to you, so your budget is cut further down. So there's a vicious cycle where we used to demand saying that give us rolling budgets so that you don't put April 1st as the cutoff date, because you've released the money only on the 30th of March. So this kind of state finance department control over budgets, once it's approved by the parliament, has to go, must go. If they don't want us to give it to an SHSC, there must be some automaticity in the release of budgets. And unless and until budgets are given to the implementing agency, you will find lapses in performance, in outcomes, outputs, everything. The drugs come delayed, the money is delayed. There's no synchronization of the inputs either. So there is an entire amount of work to be done on this particular aspect, because we supply the vaccine, we supply drugs on national programs, and the procurement cycle is very different to, DDT will be typically supplied in November when the season is over for DDT spraying, which is actually in June. So there is an entire amount of lack of synchronization of supply of inputs and so on. And therefore, we used to demand saying, you can't have a financial calendar cycle, April 1st, 31st March. You have to have a disease cycle. There are certain expenditures you have to incur when the disease is to prevent disease, like malaria has to be done pre-monsoon. You can't do it after everything is over. But these require immense imagination and require a certain amount of willingness from the finance department to bring in reform. And that, I don't know when it will come, but program officers certainly know what's happening, and they feel very bad that they're acutely underfunded.
In the interest of time, I'll just quickly answer a few questions that are directed to on the primer. I think Vikas has a number of questions that we ourselves ask, Ritvik. For example, why is PFMS data not online? Few years ago, we were, I think it was 2011 when we were asked to help think through how to make it citizen friendly. Same goes for some of the finance accounts, which are not always online, like Goa is mentioned. How do you deal with, does the primer deal with gender responsive budgets? We touch upon it, not really go into the depth of it, but we do touch upon it. There's a question on how do you deal with, why do the RTIs not match? Don't know why. But we do know that sometimes data doesn't match because of the day on which it's taken. So for parliamentary questions, and they don't always specify that, it's often as on the date that the question is, the answer is being prepared. But it doesn't always say as on this date, which is why we found this by spending time with a member of parliament to try and understand why is it that data doesn't match as well as the ministry. There was a question that I'm posing to either of you, two questions that came out. One was on the extent to which budgets are used by the government themselves to make further decisions. Are there proper feedback loops that exist within government? And also, we've talked so much about union, state, but what about municipal budgets? That's an area that I have stayed far, far away from so far. But any tips or anything that you have to share on that? I guess maybe.
I'll just be very quick about it. I think this is also goes to the question that the lady asked. I don't really think that the program managers or the government is actually utilizing the budget data the way they should. I mean, what I've been reading is that programmatic budgets that are centered around programs are much more efficient, and they're able to save more money because there are no these artificial caps are not there because you're spending on the program. So my quick answer to that is that in the current scenario, I think there is no incentive to actually do too much of optimization or efficiency spending. But if you change it from input based to program based, the evidence that I have been, I saw is that it does save a lot of money. I'll just end with one. I was visiting a northeastern state for some of the work that we've been doing, and this principal secretary told me that they're spending about 10% of the GSDP on health. Obviously, they've reached their optimum, and he wanted to know whether we can help answer efficiency questions. Obviously, there's something that's going wrong, why they have to spend so much, but they're not getting commensurate returns. So my sense, even to your question, is that the data, the budget data, the way it is right now, can't be used to answer efficiency questions at all. So for that, you really need to reorganize the budget.
Have you looked at municipal budgets?
No, I have not. Municipal budgets. Where is municipal budget? No, I have not.
I know what, maybe we can take one last question from the room. I know we're super late. Yes.
So this question is more towards like, what can be done on that front, right? So in like, if suppose you're working at the state level, what are like the top 2 or 3 things that you would push for right now that could be achieved in say a year or two? Like what kind of reform when it comes to the Ministry of Health and Finance that you would push for better overall, outcomes in general in terms of data availability as well as data use that can be pushed for in a shorter time period that, states could take up with not too much effort without like central changes as such.
Okay, I can start with my wish list, which is, I think step 1 is accessibility. Like just put out data. Many years ago, UDICE did that. And the fact that the UDICE data exists online, yes, it has its challenges. Yes, there are concerns about quality, but the fact that it's online means more people are using it and more people, and that feedback loop is starting. I remember UDICE used to give researchers small amount of money to research using UDICE data, and those reports used to be publicly available on the Ministry of Education now website. So I would say put out as much information because I don't see what you could lose, but I'm not a policymaker. That's my first.
I mean, definitions, standardization of formats to begin with. I mean, low-hanging fruits, really. Definition, very important. How do you define? And that has to be across states. So I think center has to be involved because the directive has to come from the government, the central government. So definitions, the boundaries that define health, the format standardization, maybe even things like Excel, PDF, how you can actually put the data out in the same format across all states. These are the minimum things, at least, to make this a little more friendly in the current version. I mean, all these other things we are saying is like, in the future, but at least, and I think those came out from your own document, Avani, so maybe going forward, you can actually seriously consider, are you considering reaching out to the government, central government at ministry with this? At least a list of things that can immediately do short-term, medium-term, and long-term plans around the budget. Would be nice to actually communicate.
One second. Any wish list you want to add?
No, I guess, Rani has already mentioned stuff. There's nothing that definitions are concerned. I would like to say that to a large extent, each state could come up, till we wait for standardization to take place across states, each state could come up with, for example, very few state budget manuals define their detailed heads and object codes. Now, that's something which is within the jurisdiction of state governments, right?
A pathway. We have a net zero pathway, by whatever, 10 years, 20 years. The researchers who have looked at, lived, eaten, breathed the budget. You are in the best position to kind of have a pathway, even if it might be 50 years, I don't know, but at least there is some pathway to be discussed with the government, and it should not be for the researchers' side. I think all research has to be directed for the program or the impact, and that government has to move. So rather than saying that, it should be transparent so that we can look at it and question, that is equally important. But then, what's the really government? Government has so many things to do. So,
Ma'am, sorry, there's one question here.
Ma'am, I'm not expert public finance, so you talk about the definition. So, according to WHO, the definition of health, like complete physical, mental, and social well-being. So, I want to know what is the expenditure of the social well-being. So, I'm not getting that.
क्या बोले? You want to know what's the definition of health? No.
Social well-being. How much?
Social well-being.
How much we spending on social well-being?
Do we? I mean, nobody knows what is social well-being. How you define social well-being? My point is that whichever way a country wants to define, so Bhutan wants to define happiness in a certain way. So whatever we want to say is health should be defined and be upfront, so that when journalists come and trying to figure out our budgets, they know what they're talking about. That's the simple point I'm trying to make. But what social well-being kya hai? How do? Hmm. Hmm. Hmm.
So they are defining that.
Yeah. So I think we're talking about budgets. So we have to move back from what is utopian to what is tractable. Budget में तो allocation से होगा ना. तो हाँ, तो उसमें आप इमोशनल भी डालेंगे, ये भी डालेंगे, तो फिर बहुत मुश्किल हो जाएगा. अभी तो थोड़ा हेल्थ में ही रहते हैं.
I think Tanya has something to share.
Yeah.
and
Thanks. Hi, I'm Tanya. So no question as such, but just food for thought for everyone. And congratulations, this is really a first step and where we are demystifying such a difficult topic. The length of the primer suggests how difficult the topic is, right? The primer itself is so long. So I think what Sujata ma'am also said and Indrani ma'am also said, I think one key focus is, as researchers, we need to start looking at budget execution also. Our analysis says the budget moved from 100 crores to 120 crores, but of the 100 crores, what was actually spent, nobody talks about it because that's dated data, right? You take 2 years to spend it and to report on it. So just giving you an example, in one of the northeastern states, we were working with them and we realized their budget was growing from 40,000 crores to 45,000 crores to 50,000 crores, but the spends were 15,000 crores, 20,000 crores. But nobody would ever scale down a budget because it's a political document. No CM will stand up and say, I am scaling back the budget, right? So from a research point of view, we need to also start looking at execution and reporting on that and asking questions. Second, everyone in the room kept saying budget is an accounting tool. I'm an accountant, I'm a chartered accountant, and I work on public finance. When I asked a question about accounting, I was told budget is a vision document. So we use the definition of budget very fungibly. And this was by somebody in the budget department of the government of India. So it basically, from my lens, it needs to be a tool for accountability, not for accounting. Budget needs to be done at a macro level, and as ma'am, you've been saying rightly, program budgeting, but the accounting has to be far more detailed. I think that de-link between how you are, why do I need to tell you at the start of the year how much I will spend on travel allowance for a particular program is unreasonable as of today, right? So just that link between budgeting and accounting, I think that lens needs to be brought in. And ma'am, on program budgeting, I think we are far away from it yet. But proxies for program budgeting, yes, those are low-hanging fruits, starting with chart of accounts. But again, you need the Ministry of Finance in the room. You can't have these conversations with Ministry of Health or a Department of Health. This has to be led by the Ministry of Finance. However, the sector can ask for it. The demand can be risen from here, but it needs to be replicated by the central Ministry of Finance. Lastly, congratulations again. Few ideas that we had when we looked at that document. You remember when we did that whole conversation? And as Sujata ma'am also suggested, if you pick up 1 or 2 states and do that as the next phase of the primer and see how the health budget is coming together, that's one idea. Maybe pick up a decentralized state and a centralized state, and it'll show you the difference in how the budgets are flowing. And second, as also somebody suggested in the room, low-hanging fruits for the states. A lot of the PFM is controlled by the government of India. But there are some things that definitions, for instance, a lot of states are now doing gender budget, disability budget, climate budget. Could you add health budget? Right? So those are conversations that we could do as expanding what you're already doing as part of the regular budget requirements. Thanks.
No, it's perfect. It's perfect.
Like last 3 minutes discussion.
Yes.
Taking care of the conversation.
I
Conclude.
wanted to check whether Owen, would you like to come in and close the discussions for us? I think we've all got lots of notes about next steps. So hope World Bank is interested in another partnership in continuing this work forward. But over to you, Owen.
Thanks, thanks, Avni, and thanks so much to the panelists. I think it was just a fantastic discussion. So many excellent points and ideas. I'm sorry Rukmini has had to step away and isn't here anymore. But I think speaking from the World Bank perspective, it's too bad Aparna isn't still there, but I think there is a lot of future work that can be taken in this direction. This primer is really only a start. Working at the state level and the union level. I think as Tanya said it very well, I mean, the finance department has to be part of these discussions if it's going to fundamentally change. And I think that's something where our governance colleagues can really help bring that to the fore. I think on the question of what are the low-hanging fruits, I mean, Indrani said it well. I think the accessibility and the standardization are low-hanging fruit. I would just make a plug. I'm not going to claim it's a low-hanging fruit, but I would make a plug over the medium to longer term to have a concept of a facility budget where one knows what are the resources that are being absorbed at specific facilities. They don't need to have that money in their bank account. Of course, a lot the salaries are coming separately, the commodities and so on are coming separately. But at least as a notional concept to be able to know what are the resources consumed by facilities, and then you match that up with sort of HMIS data on their sort of footfall and so on. I think that really opens the door to a lot more understanding of sort of variation in resource use and efficiency at the facility level and so on. And I think that is a direction that some countries are trying to move in. It's not easy, but I think it is a concept that one wants to move towards. One wants autonomy at the facility level to some extent, and then accountability to go with that autonomy, and the accountability needs to come with some better concept of resource consumption at the facility level. But let me leave it at that. Thank you again so much on behalf of the World Bank to CPR for this collaboration, to the excellent panelists for the discussion, to all the participants online and in the room there. Unfortunately, I can't see who all is in the room, but thank you. And I think, as we've said, this is the start of a long journey, not the start, I would say. It's a milepost along a very long journey, and let's continue to work together on this. So thank you.
Thank you, Owen. Thank you so much to Daga Ma'am and Rani. Thank you all so much. And thank you to everyone. I'm sorry I could not take everyone's questions. Big sorry. Sorry, Sushant, maybe you can catch hold of us as we're leaving. And thank you to everyone online. And hopefully this is the start of a journey where we continue to have these discussions, and including with government. Thank you all so much.
Bye. All the very best to you people in Delhi.
Yes.
I hope you continue to do better. Bye. Thanks.
Bye.
Thank you. Bye-bye.